Hello and welcome to SHRM Labs WorkplaceTech Spotlight. My name is Hadeel Al-tashi, manager at SHRM Labs. I will be your host for this SHRM Labs series where we shine a spotlight on some of the most interesting future of work innovators, innovations, and issues of today. Before we get started, I wanted to share a couple of events that we have at SHRM Labs and share some housekeeping items. Um, First, we have our 2024 Workplace Tech Accelerator Demo Day taking place next Thursday, June 13th at 3 p.m. Eastern. We would love to see you there. It's a virtual event. You will get to see 4 of our cohort companies present their HR tech solutions and reveal some of their customer testimonials. SHRM members who are certified will receive 2 PDCs for attending. To learn more, please go to shrm.org/labs and register to our event. Another event we have is our Better Workplaces Challenge Cup Finals. This will take place in person at our SHRM annual conference in Chicago. You could go to annual.shrm.org to learn more. And then we have our Workplace Tech community, which is available for all SHRM members. This is your go-to guide for all things related to HR technology. Please visit workplacetechcommunity.shrm.org to learn more. And for those of you watching on LinkedIn or other social media platforms, please share this live stream, tag SHRM, and use the hashtags SHRM Labs and Workplace Tech so we can continue the conversations later on. So now let's get into the topic. In an era where healthcare systems are experiencing a talent crisis, it's believed that there's a shortage of over 3 million health workers by 2026, which is insane. And there's escalating cost. Innovative talent acquisition and retention strategies are more critical today than ever. Traditional solutions like hard to recover sign-on bonuses fall short, failing to address the root of the talent shortage in healthcare. Healthcare organizations need forward-thinking solutions to attract talent earlier, retain them longer, and remove any barriers to entry in the field. So joining us on this to talk about this topic is Tess Michaels, founder and CEO of Stride Funding. Tess, thank you so much for joining us.
Of course. Thank you for having me, Hadeel.
Of course, yeah. And before we get started, Tess, do you mind telling the audience a little bit about you and Stride Funding?
Of course. So I'm Tess Michaels. As Hadeel mentioned, I'm the founder at Stride, and actually founded Stride about 6 years ago, very much from a student-first perspective. I was an incoming graduate student at Harvard, frankly, very struck by the sticker price, going through my own back and forth of, was it worth it to go back to school? What do the outcomes look like on the other end? And realized that so many individuals go through the same decision tree of, is the value going to be there? And ultimately, it is a real leap of faith to take that jump. And my background before that had been in healthcare finance, grew up in a family of healthcare professionals, and had always looked at how do we actually both bring the employer earlier into the equation and create more accessible pathways. In our case, it's through employer-sponsored student loan programs, but ultimately with the goal of growing the pie of people pursuing these fields and really opening doors.
Thanks, Tess. And so in your opinion, what are the unique challenges healthcare systems are facing in terms of talent acquisition and retention?
Yes. So as you mentioned, the shortages in healthcare are very real, right? As we look at that 3 million person shortage, I mean, we're expecting a shortage of over 200 nurses alone in just the next few years. And healthcare in particular has been hit by COVID over the last number of years as people saw the visualizations of what it was like to work in healthcare. And so we've seen a lot of flattening or declining enrollments in such critical industries when it comes to the education. And the reason behind that is, I mean, ultimately, one, when we think about creating access, certain roles are more specialized and require more education. Healthcare tends to fall in that bucket. And that education is just so expensive, right? If you look at most products in America, there are few to none that have risen as quickly from a cost perspective as the cost of tuition. And so ultimately, what we're trying to do is make sure that those costs are aligned with value and that people really can march into a field like healthcare, believing in ultimately the purpose, the why.
So, what do you think is are most healthcare systems turning to in terms of
Yes.
solutions to this crisis and shortage?
Almost every one of our healthcare partners, when we ask them what they used before they worked with us, primary levers were sign-on bonuses, as you alluded to earlier, as well as contract labor. And, sign-on bonuses are a way of having immediate gratification, but if anything, they're very transactional and they actually incentivize you to want to hop from system to system, right? You'll go to the next one that gives you another large sign-on bonus instead of incentivizing retention, which is ultimately how you prevent a leaky bucket, how you actually get people to stay and have tenure. And contract labor falls into that same house. It's actually pretty incredible when you look at what the rates of contract labor look like for healthcare systems.
Mm.
Most systems are paying about 2.5x the rate of a typical nurse when they use travel nurses. And when you think about what that does to ultimately the sustainability of a system financially, it has real impacts. And culturally, as you can imagine, you want to work with people are going to be there for the long haul, right? You want to feel that connectedness. And so these short-term fixes don't enable that.
Makes sense. And so, what alternative approaches do you suggest for addressing the talent shortage in healthcare?
Yeah. So, again, a big part of our belief is there needs to be ways to better connect talent acquisition and talent retention. They should not be siloed sides of the house, right? Oftentimes, TA teams are incentivized by time to close rates and ultimately getting people into the door. And then you have separate parts of the organization that focus on how do you retain them, how do you keep them engaged, and that's a big part of where we've spent our time. So, Stride Solution is offering employer-sponsored student loan programs that, as a TA tool, help employers meet talent early, engage them, vet them, lock them down, and then once they actually join the system over a multi-year period, they're helping pay down those student loans with us sending psychological nudges and reminding them of the investment that the employer has made. And to me, one of the closest proxies is actually, we recently had Memorial Day, is ROTC for the military. In a lot of ways, what they've been able to do is create pathways into doing something that ultimately has purpose, that is about doing something bigger than yourself. And healthcare, similar to the military, has that same impact, right? Again, it's like about finding individuals who are really called to care. But in order for them to be called to care, we need to remove the barriers to entry and show them that there are ways for them to enter the field and not be burdened by these hefty costs on the back end or stressed about them. So,
And how are healthcare organizations ensuring a higher return on investment in talent development right now?
yeah, absolutely. So, first of all, one of the first things that we will typically do with a healthcare partner is work through the return on investment calculator. So, we will look at what are the costs that you currently have as far as what are your vacancy rates? What do your, other forms of recruiting talent like sign-on bonuses currently look like? What does your turnover rates look like? Which, by the way, in healthcare are very high. I mean, a first-year nurse average turnover is close to a quarter, right? So 1 in 4 people are leaving within year one, which, as you can imagine, just makes the system much less sustainable. So from how folks think about ROI, in our model, it's very much about making sure that we at Stride are the actual financing partner, so we can actually help fund students upfront for their education. And we're also integrated with 100 different loan servicers, which means all of your federal student loan servicers, private student loan servicers. So employers don't pay any of the tuition upfront. They only begin making those tuition payments once someone joins them and only every month as they're retained with no clawbacks, in a way that naturally drives ROI. The other ways I think employers think about ROI outside of Stride is just interesting channels, right? How do I find lower cost talent abroad? Like, let me go to the Philippines. Or how do I think about upskilling my existing talent into roles so that the incremental value they're creating for the healthcare system improves and their retention increases because we're investing in them? So again, there are different structures to drive that same end goal, but ours is one way that we believe incentivizes at every step of the way.
And Tess, I'm curious, how has your healthcare clients been receptive to Stride's
Yeah.
process? Because
Yes.
it's a new, way of thinking, right?
Totally. So first thing I would say is it's interesting, right? Because it's not like student loan support
Mhm.
itself as a sole bucket is that innovative, right? You have players, of course, who offer student loan repayment in the benefits side of the house for existing employees. But what is innovative is how do you help employers meet talent early with the marketing around investing in their careers. So even from an enrollment perspective, individuals are willing to pursue these educational programs because they know that there is sponsored tuition and guaranteed jobs waiting for them at the other end. So the point in time matters a lot, which is what we emphasize with our partners. And it is why we get immediately moved to the talent acquisition team instead of benefits, which is exactly where we should sit. And then in addition to that, I would say, part of the fun of it has been figuring out not just what are they doing to attract and retain this talent, but what about the engagement side and the brand ambassador
Mhm.
side of the equation? So a lot of where we brainstorm with our partners is figuring out, okay, first of all, what do you need to say yes to someone? So on our applicant tracking system, there's essays, transcripts, interviews to make sure it's a cultural fit and someone who's rigorous and good for your system. But then once they sign the sponsorship agreement, committing they're going to join you, and
Mhm.
that what do we do with them while they're still in school before they join the employer? And that actually is a lot of where I would say we get creative. We already have educational support, so like exam prep with players like Elsevier. We have financial wellness tooling. We create cohorts amongst the students. But then we have employers who are like, can I include this individual at conferences to be a brand ambassador for me? Can I think about doing part-time work with them while they're still in school before they join me, right? And I
Mhm.
think that is actually where the discussion usually goes is people say, this actually makes sense. The ROI looks good, but how do I make this something that is really impactful for us as an organization that builds our brand and not just our near-term solution
I love
initiative?
that. And I feel like you kind of, touched on this, but how do you, as a person in the space, have been doing it for, uh, some time now, how do you envision the future of talent development in healthcare?
Yes. So, as we step back and think about what does talent development mean, right? So again, there is how do we, one, at the earliest, stages, think about, as I started this conversation, growing the pie, increasing the accessibility into critical fields that the labor market needs. Part two is once we have created access, how do we make sure we continue to vet that talent and make sure that there's really good skills matching? And then on the back end, it's how do we think about continuing to have ways to develop our talent so that that retention continues to be high value for the system? So when I think about different tooling, of course, I believe that we need to have TA and talent retention connect. But in addition to that, we have to figure out how do we reach talent earlier, right? How do we work with schools to actually help market these programs and drive enrollment into the space?
Mm.
And educational institutions and employers need to be working in tandem. If you take healthcare, for example, one of the biggest limiting factors is that there is a claim that there is not enough clinical placement seats, right? So in order to do healthcare, you need to be boots on the ground, you need to learn by doing.
Mhm.
And healthcare systems do actually have enough clinical placement seats, but they're at odd hours. They can do night shifts, they can do weekends, which many times students in schools may not be amenable to, right? So, one is how do we actually be more flexible in our thinking to create the training and mentorship needed for someone to not just be exam ready, but to be job ready. Second is once we have actually engaged them, how do we think about additional tooling while they're in school to make someone ready for the job, right? So, we actually just recently did a talk for one of our webinars where we were talking with a healthcare expert who's like, soft skills are really important.
Mm.
Patients are not always the easiest population because they're going through some of the most stressful days of their lives, right?
Mhm.
So how do we think about actually, helping people go through stress management and all of the stuff that comes around along with EQ to be great at the job, right?
Mhm.
And then the last piece is the upskilling, right? So continued development of talent. I mean, we have healthcare systems that use us. For example, we have one that is going to go live that takes home health aides and upskills them to be nurses, right? And so how do we think about taking non-clinical talent and training them into clinical roles, or taking clinical talent and upskilling them even further in their development to really see that upward mobility in their career? So again, I think that there are a lot of different places that you can see innovation there, and I think
Mhm.
our offering is one way to really connect those dots. So.
I love that, Tess. And you have to be creative when, where we're facing the level of shortage and talent crisis that we are currently facing in talent healthcare. Any resources, anything that you can share with, folks that are in the healthcare space that are interested to learn more about creative solutions or
Yes.
just different way of thinking about talent acquisition and retention in healthcare?
Yeah, absolutely. So a few things. One, I would say, standalone, if you're interested in just healthcare resources, one of my personal favorites is Becker's. They have conferences, they have really good newsletters, but it's a great. I know we are also doing a SHRM Pulse article that is coming out very soon that will speak a lot about our experience and our learnings in the talent acquisition world, specifically within this industry. And then, of course, I'd be remiss to not mention, I think, check out our site, Stride Funding, like hityourstridefunding.com. We have lots of information as far as white papers that we've done, testimonials from folks who have worked with us, and then again, just fresh ideas on how we think we can really shake up talent acquisition and talent retention to make this system work more smoothly.
Appreciate it, Tess. And you did disconnect there for a little bit, but I encourage everyone to also maybe connect with you directly on LinkedIn if they have any questions or want to follow up after this conversation. But unfortunately, this is all the time that we have for today. Thank you so much, Tess, for this wonderful conversation. And I want to remind everyone that we will have our Workplace Tech Accelerator Demo Day next Thursday. So you will get to hear also from Tess telling more and sharing more about her solution. And you'll hear also from one of their customers in the space around the impact that Stride Funding has made in the space. But thank you again, Tess. And if everyone that is interested in learning more about Stride Funding, please go and visit www.stridefunding.com. If you've enjoyed this live stream, please share it. Use the hashtags SHRM Labs, Workplace Tech, and don't forget to tag SHRM. But let's keep the conversation going and engage with us in the chat as well. And if you want to know about upcoming events at SHRM Labs and the ones that I've mentioned earlier, feel free to visit our website at shrmlabs.com to stay up to date. Thank you so much for your time. Appreciate you, and have a great Friday. Take care, everyone.